And welcome back to American Agenda. I'm Heather Childers. Bob Sellers is off today. Senator Rand Paul stepping things up, saying that he is now going to send a criminal referral to the DOJ to investigate Dr. Anthony Fauci for the crime of lying to Congress. Of course, Dr. Fauci and Senator Paul pressed each other yesterday. They went back and forth over this COVID research funding in a fiery exchange. It's actually the gain of function research being paid for that was really the main point of all this. Let's bring back our panel to discuss more of this. And I want to get your reaction to Senator Rand Paul laying out the evidence that Dr. Fauci did, in fact, lie to Congress. Listen.
On May 11th, you stated that the NIH has not ever and does not now fund gain-of-function research in the Wuhan Institute of Virology. And yet, gain-of-function research was done entirely in the Wuhan Institute by Dr. Shi and was funded by the NIH. In this paper, Dr. Shi credits the NIH and lists the actual number of the grant that she was given by the NIH. In this paper, she took 2 bat coronavirus genes, spike genes, and combined them with a SARS-related backbone. Dr. Richard E. Bright, a molecular biologist from Rutgers, described this research in Wuhan as the Wuhan lab used NIH funding to construct novel chimeric SARS-related coronaviruses able to infect human cells. Dr. Fauci, knowing that it is a crime to lie to Congress, do you wish to retract your statement of May 11th where you claimed that the NIH never funded gain-of-function research in Wuhan?
All right, Hal, I will start with you. So he laid it out right there, and what he was describing, the type of research being done was in fact gain-of-function research, and the NIH did provide funding for this lab that was doing the research, albeit through this organization called EcoHealth Alliance.
Yeah, well, let's start with the funding part. I mean, what Fauci is trying to say is that the $600,000 said that it wasn't supposed to be used for gain of function, but money is fungible. I mean, if the budget for the lab is $3 million and you give $600,000, are you funding gain of research if the lab is doing gain of research? I mean, of course you are. That's like saying if you give money to Planned Parenthood, you're not giving money to support abortion because it's separated somehow.
Which some people try to make that claim.
Well, yeah. It doesn't work very well, especially when the government is funding specific research in a lab that's doing gain of function. And then the second argument he has is that, well, that wasn't gain of function. And it clearly was. And by the way, it's looking more and more likely that COVID-19 was a gain of function virus. 2 doctors came out with an op-ed a couple of months ago in the Wall Street Journal and gave 2 reasons for why that virus looks to be very much a gain of function virus. One being the sequence of the CGG sequence, which is a protein in the virus, and that being a very rare thing in nature. It's never happened in a coronavirus before, but it happens to be the most popular sequence done to inject and create gain of function in a lab. Mm-hmm. And the second is that the virus was very much optimized when it first came out to be very infectious without mutating much. And so that's not normal in nature either. Normally when a virus comes out like SARS or MERS, initially it'll mutate quite a bit, and then the most dominant form will take over, that the most infectious form will dominate. Yeah. That didn't happen in this case. So their view is in those 2 instances are very much likely that this was a gain-of-function virus that we're talking about from COVID itself. So I just think it's very difficult for Fauci to sit back and say he didn't know, especially when emails came out showing in January he was warned about this.
Yeah, we actually had Tom Fenton from Judicial Watch on earlier talking about some of those emails that they were able to get their hands on.
August 31st, it could be you.
Awesome. $5,000 a week for life. Enter now at PCH.com.
An organism or disease, and then it alters it in some way, and it makes it the transmissibility of it greater. And that's what they're saying was happening there at that Wuhan lab.
Yes, and animal to human contagion increases. Obviously, Dr. Fauci tried to deny that it was gain of function when the very definition by the National Institutes of Health was exactly what was going on in the Wuhan lab. I find that this cover-up is worse than the crime now. There are emails that were revealed at 2 a.m. when Fauci apparently is very frantic, trying to wiggle out of this, backpedal out of this, and his own assistant essentially said This is gain of function research. They know that this money somehow got there, whether he was directly engaged in embracing it or it was an innocence of let's send them funding. Regardless, the money went to this lab, and they cannot keep denying it because now there's direct plausibility and accountability by Dr. Fauci. He is the highest paid employee in the government, according to what I've heard. And if he's not, he's quite close up there. Number two, his level of expertise and his appearance among doctors has caused a lot of virologists not to question him because of the censoring and the suppression that has been going on.
Yeah. And that would put in danger their possibility of getting funding. So it's opened, I think, a lot of people's eyes as to actually how a lot of this works behind the scenes when it comes to funding and some of the things that happen within our government. Derrick, just finally, what should happen to Dr. Fauci? Because as we said today, we have, Senator Rand Paul saying criminal charges and saying the DOJ needs to step up and get involved.
And Heather, I agree that there definitely needs to be an investigation. I agree with Hal, and I agree with Jesse James, and all those. Now, here's the thing. The other thing that needs to be pointed out about with Dr. Fauci. When I was a federal employee, we had several meetings and several, we had to sit in there to tell us what we could say and what we could do on social media. I mean, it was a huge crime. You cannot, as a federal employee, benefit from your job and make money. Fauci has written books, he's on TV, and to this day, I don't understand as a federal employee how he's able to do that. That's the first thing. The second thing is, in America, if you have a surgery or anything, you go get a second opinion. I've said many, many times, there are doctors who have the same letters, have the same criteria, have done the same study and research that Dr. Fauci has, who have been silenced. And I understand why Fauci is the authority on this particular issue, and he's not. And it's unfortunate that the media has put him up there, and this narrative continues to be driven by Dr. Fauci, who's been caught in numerous amount of lies in his testimonies before Congress. And I think he needs to be held accountable for it as relates to this COVID-19 hitting the United States and to what he's doing right now to this economy and to America.
All right, Derrick, thank you. Thank you, everyone. Stand by, though.